When dealing with a child, try to be punctual. It's best not to keep them waiting. The timing of the appointments is crucial. Babies and younger children are best seen when they're most alert, which will probably be in the morning. Older children are best seen after school when their binocular vision issues might be more apparent. Remember, mum knows best and parents know when their child's most likely to be cooperative. Parents have an important part to play when seeing children. Always take them with you into the consulting room. They will use language the child understands and can help you communicate with their child. Parents should be asked in simple terms about any signs of possible eye turning, covering or closing of an eye, headaches, observed eye rubbing, and how a child is doing at school. As well as including the parents, remember not to ignore the child. Build a rapport with them and try to understand their needs by asking whether they enjoy reading, whether it's clear to read, and can they see everything in the classroom. Children are often unaware of visual problems. They think everybody sees that way, so they don't complain, so be ready to ask more questions. Always explain what you're doing using simple words and phrases at a speed suitable for the age of the child. Consider showing them each piece of equipment and be flexible enough to allow extra time for these explanations. Having fun during the appointment is really important. It helps relax the child and this will help you gather information that you need. Be flexible with your procedures and the order of the tests to try and hold the child's attention. Have lots of small, fun, near targets available for important tests such as cover test and motility. This can include easy things like pop-up toys, novelty torches or stickers. And what did you find out when they had their eyes tested?
Hamish was fine. And as you can see, Gabriel needed glasses, which was a bit of a shock. He never liked to play hide and seek with us in the garden before. We thought perhaps he was quite clingy, and he wasn't. He just, he'd always want to hold our hands so that he knew where we were, because if we went at a certain distance, we just became blurry. And mother's guilt. You talk to yourself and think, oh, he didn't know any better, but I had no idea. So, he's a different boy now. Absolutely different boy. Since he got his glasses, he's become much more independent, much happier to play on his own or far away, and now he loves hide and seek. And taking him to the cinema and all these things, he's a normal boy now. And you think perhaps he wouldn't have realised until he was 7, when they're looking at the blackboards and things. By then, he'd have been going on for years. So can't thank Holly enough, really.
Always praise a child during the test and end on a positive note. When a child fails an acuity level, return to an easy level to keep them happy and confident. Kids love all sorts of gadgets and technology. A computer test can be great for keeping their attention. The ability to alter the target can be useful for both retinoscopy and when measuring visual acuity. And do use the scroll function to keep your target line central to the screen, allowing crowding effects to occur and therefore giving you a better measure of their visual function. Try to minimise the use of the trial frame, as it can be intimidating, distracting and uncomfortable. Using a mirror to show the child what they look like in the trial frame can dispel some of the fear and make things easier. Flippers are a great alternative both for refraction and vergence testing, and monocularly occluded specs also come in handy, and they come in bright colours that the kids love. Colour vision assessment is vital, as this is an ideal opportunity to identify those colour defects which may impact on their educational development and future career. Be vigilant and supportive. It's common for a child to attempt to look round an occluder or screw up their eyes. Don't expect children to perform as you want them to. Always look back at your own technique and your approach if your tests are unsuccessful. Think how you could adapt to get the results you need. When prescribing, always consider giving the full prescription to minimise the chance of amblyopia. And remember, don't hesitate to refer for orthoptic or ophthalmological opinion. Contact lenses are a useful alternative to spectacles and can be used to great effect, especially in selected young children. Make it easier for parents to retain the advice that you give them by producing simple fact sheets. You can then hand these out at the end of the appointment, make them available on your website, or even deliver them to local schools and nurseries. Visiting the opticians can be daunting for children. Try to make your practice child-friendly with children's books, paper and coloured pencils. And if possible, have an easily accessible toilet available. Always be enthusiastic, friendly and show a genuine interest in what the child has to say. Be aware that getting your first pair of glasses is a big deal for a child. Talk positively about wearing spectacles and show the child how to look after their own pair. Ensure that the child and parent is aware when the spectacles should be worn and answer any questions they might have. Keep lens choices simple. Explain your professional recommendation and offer alternatives, being careful to set realistic expectations of the glazed spectacles to avoid disappointment. Make the parent aware of the protection offered by different types of lenses. Guide the parent and the child on frame selection and be on hand to offer your professional judgment. But remember that the frame the child chooses is the one they're more likely to wear. If it's the child's first pair of glasses, remember that kids wear specs they like, so be sure to let the child see how good they look. Ensure compliance with regulations at all times. All aspects of the dispensing of spectacles to children must be carried out or directly supervised by a registered optician. Carefully determine facial measurements and measure interpupillary distance on each visit the child makes to your practice. They do grow. Finally, consider inclusion of vertical centration measurements. As well as the dispensing, the verification and collection should also be supervised by a registered optician. Remind the parent and the child of wearing times and be enthusiastic about their new spectacles. Be sure that the spectacles are fitting properly. Ensure NHS vouchers are accurately filled in, signed and claimed for. If you're in any doubt at all, do double check with your PCT. Remind the parents that you're on hand to provide any support they might need in the future. Most importantly, make sure that the child leaves your practice happy.
What shape's that? You can't see it without your glasses, can you? Are they clever glasses?